Actually, in early years, right, we don't have not many staff. We work as a family. Our teamwork is very strong. We know each other very well. There's always a case when we stay back to do our works. You know, our working hours actually on Saturdays only up to 1 o'clock. Sometimes when finish at 1 o'clock, we're up from the clean room. Then our pharmacy said, hey, got one more patient in the ICU that need the bags. We just straight away, okay, we gone out again, go in again, wash and start to do all the preparations. So we need a kind of teamwork. Like we need a pharmacist, a technician, whole team to make this happen. And sometimes they come to me and say, Rizwan, you've been staying here for 35 years. How you can, tahan all this kind of pressure? So I got this opportunity for me to share my experience, especially to the juniors. I share to them the importance of the team spirit. I share with them, how to work together, how to make a working place is a nice place to work with. Patient is very important to us. We never ask for OT, we never ask for anything. So we just do it because we feel that we do something good for the patients.
So to me, whenever you talk about respect, I always remember my old teachers. The important thing is that from my old teachers, for example, one particular name I mentioned is Professor Seah Cheng Siang. And he taught me that medicine is listening to the patient, what he has to say, assimilating this information, and then examining him and coming to a diagnosis even before you do any investigations. And you have to understand what the patient tells you rather than telling him what you think is a diagnosis. These are very, very important attributes in medicine that I actually learned from him. Also because the way he treats the patient loves him. They are very strict with us, but they will take a lot of time to listen to the patient. And I think this is a very important aspect of medicine. Respect for your patients as well for human beings.
Integrity is not something that needs to be viewed in isolation. To me, it is intertwined very intricately with compassion and passion. In my early days of nephrology, dialysis used to be rationed. The majority did not have access to dialysis. It was my generation of nephrologists who advocated for dialysis for everyone. And to me, I feel very gratified because fighting for every patient counted. We're now able to proudly say that, yes, any patient can have access to dialysis in Singapore without having to worry about the financial problems associated with dialysis. Access to dialysis is a fundamental right in Singapore because of the work we did.
What I've been doing over the years, when I became the sister of the ward, I carried on my practice of going beyond for babies who are waiting for foster care or waiting for adoption. We just buy baby clothes. You can see the baby have more soft toys than normal babies because the nurses just get really enjoy doing little bits for the babies. So it has become like a tradition now. Nurses taking their own initiative to do it, and I'm so happy when I make my rounds, when I see my nurses going beyond their call to do things for their patients. It is not something that every nurse would be comfortable to do. And when they see that someone doing it, it makes them, oh, I can do this, and it doesn't implicate anything. It makes the nurses feel very fulfilling and a lot of satisfaction.
Excellence is important because it means better outcomes for our patients. The pursuit of clinical excellence is very important because it implies we will be determined to chase after better outcomes for our patient regardless our situation and difficulties. And I think NUH is good position to do this. I would like to talk about my seniors in urology, Prof. Kesavan, as well as Dr. David Consi. They have been pioneers, not just in NUH. In the early days of the department setting up, there were not many doctors with their urological skills. In those days, they would be on call, working every weekend, looking after patients. The commitments of their weekends to look after patients tell me excellence in clinical care is not just having a specialty skills, but it also requires a grit and resilience. And they have shown me that these values can be transmitted to our future generation.
When I was a medical student and then a surgical trainee, Prof. Ralph, he was the head of our Department of Surgery, and he is a living and walking legend. One night, he came to help a senior registrar with an unusual hernia operation. But as soon as he was called, he came down. There was no fuss. He brought all his experience and skills to this old gentleman who could actually have died from a serious complication of an intestinal obstruction. As surgical trainees, and to see him come down in the middle of the night without fuss, at the service of the team and at the service of the patient, it was quite inspiring. Our central core value is compassion. Teamwork, respect, integrity, and excellence, they all revolve around compassion. And the expression of all these values put together is patient-centeredness. This translates to our work as a public healthcare institution. We have a duty to provide the best care, especially to the neediest patients. And when we keep the patients at the center of all that we do and have the patient's best interests in sight, we won't go wrong and patients will not come to harm. Our incredible care strategy is designed to support this. Team NUH today, just like the pioneers before us, we will bring hope and provide incredible care to all patients who come through our doors.
Every day, I work in the operating theatre. Every day I see respect.
I believe compassion is inborn, but over the years, you strengthen it.
To me, I believe if you love what you do, then you will excel in whatever you're posted to, so that we can able to achieve what we want to achieve.
For me, it's a matter of my professional integrity for me to advocate for my patients. And I'll find many ways to achieve that.
We are the next generation and hopefully will be faithful messengers of this clinical excellence.
That's who we are. It is our distinctive tradition.